Hey, everybody. Happy Wednesday afternoon. Alan Weber here from the mayor's office. Once again, reminding everybody wear your mask, practice physical distancing, wash your hands, use hand sanitizer. We're in the yellow, but we don't want to slide back into the red. We're not out of the woods. So remember, masks still count. They're important. Even as we open up, as we are allowed to do more fun things, go to a restaurant, be careful, stay safe, wear a mask, practice physical distancing. It'll keep us in the yellow, and next we're going to go green. So our goal is to get to green. Uh, we're very fortunate today. I feel like we're incredibly fortunate today because we have as our guest Dr. Laura Parajon, who is a not new to COVID, but new to a position with the Department of Health, taking on a deputy secretary role at DOH and looking into the vaccination process. And we're so appreciative, Doctor, that you're here with us because vaccinations are coming. We know we're doing everything possible to get more shots in people's arms, but there's a lot of questions about rollout and how well individuals are doing. So thank you so much for joining me and the people of Santa Fe in this conversation. Please take off your mask and join us.
All right, great. I was just supporting your mask wearing efforts. So
yeah, and I appreciate it. We do need to be consistent. If we want folks to stay safe, we should remind each other to stay safe. So thank you for the visible reassurance that masks work.
Yes.
So let's just kick this off. You have a very important new position, not new to COVID, but new to this position. Tell us a little bit about yourself and about what your new role at DOH is, please.
Okay. Well, yeah, thank you so much, Mayor, for having me on this program. I'm really grateful. And I am a family physician and also a public health person. I have a master's in public health. And I've spent most of my career working in marginalized or lower income areas, both here in New Mexico and also internationally in Nicaragua, and ironically in big vaccine campaigns, as well as implementation of rural primary health care. So I was really fortunate to be able to be working at University of New Mexico in the Office for Community Health. It's an office that works with all different primary care locations in New Mexico. So I actually had the opportunity to kind of know the state before coming onto this position and working closely with the DOH most recently in the city of Albuquerque as a medical director for people experiencing homelessness for their COVID-19 prevention program. So while this is a new position, it's not a new COVID is not new to me. So unfortunately, I've been doing this since March, mostly COVID work. And so now my new job is as the Deputy Secretary of Health is working with 3 departments in the Department of Health, the Public Health Department, the Epidemiology Department, and also the State Lab. And so I've been put in charge of the vaccine, part of the vaccine rollout, amongst other things. Yeah, but primarily vaccine right now.
It's one of those deals where you've been preparing for this job all your life, and here you are.
It kind of feels like it. Yeah. A lot of the stuff that we do, it's really about teamwork and working as a team with all the different, like really amazing people at the Department of Health, and how we can all work together towards this goal of helping New Mexico be, immune from COVID. That's our goal, right? Getting the whole state green.
Everybody green and everybody vaccinated. And then apparently the medicine what we're hearing from national public health experts is we're just going to live with COVID like we live with the flu. We just have to prepare for that as part of our future. And if we do the right things now, we'll be much better positioned in the future.
Exactly. Right. You're the doctor now. So that's perfect.
I'm not wearing a white coat here, doctor. You're the doctor.
Very good. That's excellent. That's really the way we're going to get the green.
One thing that I've been told, and maybe it's not correct me if I'm wrong, is that one of the things in your portfolio is the issue of equity and fairness, that
Correct.
we're very sensitive to making sure that everybody gets treated fairly, everybody gets a shot at getting a shot, and that whatever your zip code is, whatever your housing condition situation, the state and you as the deputy secretary, you're looking at equity as an absolutely essential part of our COVID strategy.
Yeah, absolutely. It's actually baked into our vaccine mission. So the way we organize our vaccine structure is actually has as a mission the equitable distribution of the COVID-19 vaccine to look at two things, right? How are we preventing death and disease by using the vaccine? But also how are we preserving societal functioning, like getting our, the healthcare staff all vaccinated so they can take care of patients. That's the 1A group, right? And right now we're in how do you prevent people who are 75 and older who are more, prone to getting very sick from COVID vaccinated, as well as those with comorbidities or chronic illnesses, get those people taken care of as well. So that's kind of where we're at right now.
Okay, let's talk about a snapshot of where we are right now. I went, before we got together on this call, I went to the Vaccination Dashboard of the state, which is a phenomenal resource. People who are watching or listening, if you haven't visited the DOH Vaccination Dashboard, it is a treasure trove of good data. Up till now, it said more than 450,000 doses administered statewide, 75,000 doses in just the last 7 days. So that's a good thing. We've received from, I guess the feds is how you describe it. The feds have sent 454,000 doses. Here's the gap. We have 627,000 people registered. So that gap between doses received and people waiting for that phone call or that text message, that's where the anxiety is happening right now.
Absolutely. Yeah. That's where people are waiting. And we're really excited that New Mexicans want to get vaccinated. We're excited. Our state is excited about this. But yeah, we have a supply issue right now. And as we get more supply, we're going to get more New Mexicans vaccinated. So and yeah, we're excited that people are signing up. It's really important.
So that's the first step for folks. If you haven't signed up, there's a website to do that. If you have signed up, some people have said, go back and double check because you may have signed up early and if you haven't heard from DOH, maybe there's a glitch in your initial sign up. It's okay to take another look-see and make sure your registration is active. Is that a fair thing to do?
That's very fair. Yeah. And basically making sure that as whenever you do get you'll get a confirmation code first, and then please be patient. Like you were saying, there's 100,000, 200,000 people all waiting to get the vaccine. If you just wait, and then it'll send you a event code, and that's the code that will allow you to then get scheduled.
Great. So let's talk about, I'm sure you hear these concerns. I hear them on a daily basis. The city doesn't do vaccinations, but we've offered and continue to offer to Department of Health. Do you need a building? Do you want to borrow our firefighters? What can we do to facilitate things? It's pretty much all about supply. But when folks send the mayor an email and they say, I'm 75, I have an underlying condition, I registered, and it's crickets out there. I haven't gotten my vaccination. What can we tell folks about either why that's the case or when they might get a notification, how to get better information? What are the steps we can offer folks so they don't just feel like nobody is paying them any attention? Because I know you are deeply invested in doing the right thing.
We really are. And we really are prioritizing the 75 and older people right now. And so if you are 75 and older and you do have a comorbidity, hang tight. You are the first ones in the line right now. And so one of the things we have done is make sure that that we're also vaccinating at senior centers. We're taking up people's offers to like you said, like, thank you to the cities, to the providers, to the counties who have all offered up spaces and people to help vaccinate. The most important thing is hang tight. You guys are next, the 75 and overs, and we are prioritizing them. And so the 75 and older group, we're now at 43% of the whole population. So that's up from 30% last week. So it's taking time, but like you said, there's thousands of people in front. So within the next few weeks, I'm hoping you will get a vaccine if you're 75 and older.
So, doctor, you are underselling your performance. I checked the dashboard. You're at 45%.
Oh, well, there you go. Excellent. It changed overnight. Thank you very much. Yeah.
Help is on the way.
Yes.
We got Mayor's got a briefing from Dr. Scrace last week saying a lot of it depends on supply, but there was a 16% increase in supply 2 or 3 weeks ago, a 6% increase in supply, then only a 2% increase in supply. A lot of it is the Biden administration trying to get the supply process straightened out and moving effectively, I guess.
Absolutely. Yeah. I think this week we have about 70,000 doses that we've gotten. And so, yeah, every week we get a little bit more, but we're really waiting for the time when we can get a lot. And then we will be able to utilize and partner with all of you who have offered to have these sites and really just full-blown vaccinate. I think that's the beautiful thing about New Mexico. You know, we're ready to go, right? We have a lot of sites where we can go to.
And you've got the personnel ready to put the needles into people's arms. So I know comparisons are always odious, but a lot of folks say, well, what about Texas? What about, my daughter in California? They've got vaccination rodeos and you pull up in your pickup and you get a vaccination. We're not doing that. We're doing something it appears the organization is important, the structure, the priorities, kind of playing by the rules is part of what the state's trying to do.
Well, I think playing by the rules and also the rules that actually favor the people who are most vulnerable, right? So we are very concerned about the people who are most likely to get sick, and we are vaccinating them. And if you look at our most recent modeling, I believe Dr. Scrace and Secretary Collins will be talking about that today in their press conference, but it definitely shows that the vaccination process we've been doing, which has really targeted people who are sick and also people who are 75 and older, that has reduced our rate of COVID transmission and COVID rate in the state. So what we are doing as a state is working. So New Mexicans should be proud of our whole state and this effort that we've been doing together.
I think that's great news. Yeah, there's a gap between what would have happened with no vaccines and what we're getting with vaccines. And it's about, a 16% improvement over failing to vaccine in a strategic way.
Yeah, absolutely. And it's great to see.
Let's talk about some do's and don'ts.
Okay.
So Santa Fe County, we're proud. We got from red to yellow.
Yes.
It's a big deal because we want our economy to open up. We want folks to have a better life experience. We want to be safe at the same time. So how do we balance opening up with staying safe, and what are the fundamentals we still need to be doing?
I mean, I think you announced that at the very beginning, Mayor. If we are opening up, that means we have to be a lot more vigilant about wearing our masks, about social distancing, about doing all the things that are going to prevent us from going back to red. And I do want to mention one thing that just came out in the CDC was that a lot of people are talking about double masking and making sure you have a good seal. And so I do have a little demo here that if you can get one of these surgical masks and put that on, right? And then get your regular cloth mask and put that over like this. And what you're looking for is a really close seal so that air doesn't come out on the side and air doesn't get in. And if we can do that as we open up, this is for community masking. We're not talking about what we do in the hospital or in the clinic. This is what we do in the community. If we do that, it has been shown effective that you can safely open up schools, you can safely open up spaces. When I was working in the shelters, as long as people were wearing their mask and safely distancing, we did not have COVID outbreaks. So we do know there's a lot of non-vaccine ways right now to prevent the spread of COVID. So I think reinforcing that as we open up, that we can't let down our guard on wearing our masks, right?
And how worried are you about the variants that we're hearing about from England and Brazil and other places where there seems to be it spreads more rapidly and ends up putting more people back into the hospital? Are we seeing that cropping up in New Mexico, and is that another reason to be doubly vigilant?
Yes, and we're starting to see that everywhere in the United States, not just New Mexico. And we are being vigilant. Our state lab is doing an excellent job of actually doing the genomic sequencing necessary to actually track those variants. And so we are doing that work, but also, once again, the vigilance around the mask wearing. If everybody wore a mask, we would not really have as big of a problem as we do, when we get into the red. So really, to me, it's like, yes, the variants are really important. We have to recognize that, but more as a way to tell us, keep your masks on, keep on the prevention, because we can beat this if we do that, if we do the prevention.
And talk a little bit about testing, because we've shifted gears. For a long time, we were telling everybody, we're going to get tested. There's now the free at-home test, which is Vault Health. But we've kind of shifted gears, at least in messaging, to talk more about vaccinations. I assume testing is still a critical part of our own surveillance of how well we're doing.
Absolutely. So you still have to get tested if you become symptomatic. That's the main way we can identify someone with COVID. So if you have any of the COVID symptoms, go get tested. If you are positive, isolate, figure out, the Department of Health will help you figure out who are your contacts so that then they can quarantine. But yes, testing is still really important, and it's still available throughout the state. And if we have to do both.
We have to do both. And if we want to stay in the yellow, if the only people who test are people who are symptomatic, we'll slide back into red. So we need to have a bunch of asymptomatic people test so we stay in yellow.
Yeah, so it's important for people who, there are a lot of places that are testing surveillance in their workplaces. So that's really important, continues to be important. So continue testing, continue practicing safe COVID practices.
Okay, you're so generous with your time. I appreciate it, Doctor. Let me raise a very sensitive issue, which is nationally a very sensitive issue, and that is return to school.
Yes.
And I know the governor's trying to get folks, young kids back into school. Teachers want to be safe. Are we looking at a vaccination program for teachers that will expedite getting shots in teachers' arms? Where do they fall in the priority list?
So teachers fall right after the people with comorbidities. They're up next, is in front of the frontline essential workers. They're essentially one of the first to get vaccinated in that group. They're also there with other frontline essential workers who are really important, such as grocery store workers, people who are, in other essential jobs, restaurant workers, people who've been on the front lines this whole time. They're in that same group. So yes, we really want to get through this group of people with comorbidities so we can get to our teachers. We are awaiting some federal guidance. So let's see how that rolls out. But we do feel really well assured that following COVID safe practices has allowed schools to open safely. So that's something that we feel assured about. And it is really important for kids to go to school too, for their mental health and well-being. So I think when the CDC had those recommendations, they're weighing those two things, as well as identifying the fact that so many schools haven't been able to open with COVID safe practices.
Great. So it's on the radar screen. It's coming up next.
Yeah, it's on
And
the
it
way.
does, as you said, I mean, school and family has so many different elements to it in terms of how the kids grow, how they learn, how the families function, how mom, dad are able to feel like they're back to work. It
Exactly.
touches, it's one of those through lines that touches so many different parts of our lives.
Yeah, absolutely. And we're also working on a testing program too to help the schools to be able to identify anyone who does have symptoms more rapidly. So we're looking into that as well. Our team, we have a great team at the DOH, and so they're working on that piece as well.
Great. Uh, we've been at this for a while. You are very generous with your time and very, very forthcoming with the information. Any last thoughts about how we can, as individuals, people in the community, what we can do to help other people? How do we help the system work better? How do we help the DOH? How do we all make it through this healthy, safe, and open as a community?
Yeah, I thanks so much for sharing that. I think having programs like this where you have a large audience who can then listen to, how we keep each other safe, keep on encouraging those around you. I know, especially younger kids, like my kids even, like keep on wearing your mask, like don't go and hang out and party with your friends, like let's do that next year. Just kind of like, holding each other a little bit accountable, but with positivity, like, let's get through this and we can do this together. If you have older family members or friends who need help with registering on the app, please help them register. It's not that easy sometimes for older people to get on digitally. So yeah, I think just the whole like New Mexican feel of like, let's help each other, let's get through this together. I really feel like that's what's going to get us through. So
Well,
keep on
thank you.
keeping on.
Thank you, first of all, for taking on your new responsibility. It's a lot. It's a lot of responsibility, but it's, as you said, you've been working in this field, and you know what you're up to. You know what you're facing, and you're going to bring us through it with you. And so, thank you for that service to the community, and thank you for joining me today on our regular webcast. It's great to see you, and
Yes.
if you're available, we'll have you back on with an update.
Awesome. Thank you. Yeah, I hope we'll have an update with more vaccines soon. So thank you so much.
Great. Thank
Thanks
you,
for all
Dr.
you
Laura
do, Mayor.
Powell. Thank you very much. We'll see you again.
All right. Thank you, Mayor.
Take care. Bye-bye. Well, I think, folks, that we're really fortunate to have Dr. Parajon on our team and in the position she's got at the state and making a big contribution. So we're going to make it through this, and that's the good news. There'll be more vaccines, more vaccinations. If you have questions, send me an email. We'll ask them next time we're together. Let me turn the page to some other things, still COVID related. There is the Vaccine Dashboard. Please check it out. cvvaccine.nmhealth.org, publicdashboard.html. Santa Fe County is 6th of 33, and we're making progress. So that's good news. Please shop local. If you aren't yet shopping local, please do it. SantaFeMarketplace.com allows you to shop local. There is free at-home testing with learn.vaulthealth.com/NM. There is the Novid tracker, which you can download to your personal device. A few other things I want to alert you to. Native American Native Community Food Distribution, Santa Fe Indigenous Center, 1420 Cerrillos Road, February the 19th, Friday from 10 a.m. to noon, a food distribution at the Santa Fe Indigenous Center. So please check that out. We don't want people to be hungry in Santa Fe. There are some great library events coming up. SantaFeLibrary.org, some Meet the Author opportunities. Please check those out. SantaFeLibrary.org will allow you to take advantage of some great Meet the Author, Listen to the Author events, courtesy of our creative library folks. That's about it for today. There's some other stuff we'll cover next time. It was great to have Dr. Parajon on with us and we will revisit COVID practices, COVID safe practices, progress on vaccinations on Friday when we reconvene. So I will see you then. Until then, remember what the doctor said: wear your mask, practice physical distancing, stay safe, take care of yourself, take care of your families, take care of our community. Working together, we're all going to take care of Santa Fe. We're going to stay in the yellow. We're going to get to the green. We'll keep opening up as things develop and make sure that Santa Fe is vaccine friendly, people getting medicine in our arms, people stopping the spread together of COVID-19 going forward. So till I see you next time, stay safe. Let's work together. Take care of yourself. We'll all take care of Santa Fe. See you next time. Bye for now.